Welcome to The Explainer. Today, we're putting on our detective hats and jumping right into a medical mystery. And it all starts with a single, simple symptom: puffy eyes. So, let's meet our patient. We're looking at the case of a little 3-year-old boy, and his symptoms, which seemed so innocent at first, ended up kicking off a full-scale medical investigation. And this wasn't just a one-day thing. Over the course of 6 weeks, that little bit of puffiness around his eyes just exploded. It spread relentlessly until he had this severe, body-wide swelling. I mean, his limbs, his belly, everything. The medical term for this is anasarca, and it's serious. So the big question is, what on earth could be causing a 3-year-old's body to swell up like this? All right, let's dive in. We're going to follow the clues just like a real medical detective and piece this whole thing together. Okay, so every good investigation starts with gathering the initial clues, right? You have to listen to the patient's story, and in this case, the first really big clue comes from the swelling itself. The doctors, our detectives, they spotted a really key pattern. The swelling was always at its worst first thing in the morning, especially around the soft tissue of his eyes. Then, as the day went on and he moved around, it would get a bit better. Now, that might seem random, but it's not. It's a classic textbook sign that points a giant flashing arrow right at one organ system: the kidneys.
All right, so we have a prime suspect, the kidneys. But a good detective doesn't just stop there. You have to rule out other potential culprits. So the investigation actually widens a bit to make sure we're not missing anything. And they do this by asking a series of really smart, targeted questions. It's a process of elimination. You ask about breathlessness or chest pain? Nope. Okay, that probably rules out the heart. Jaundice? Nope. The liver is likely in the clear. What about rashes or joint pain? Nothing there either. That makes an autoimmune issue pretty unlikely. You see how this works? The trail is definitely getting warmer. So with the heart, the liver, and the autoimmune system all crossed off the list, the focus snaps right back to our number one suspect. All the evidence is pointing in one direction. And that prime suspect has a name: Nephrotic Syndrome. Here's what that means in simple terms. Your kidneys have these tiny little filters. Their job is to keep all the good stuff, especially protein, inside your blood. Well, with nephrotic syndrome, those filters get all leaky. They're damaged, and suddenly, massive amounts of that precious protein just pour right out of the blood and into the urine. Now, to really nail this down, it helps to compare it to its clinical cousin, nephritic syndrome. They sound similar, but they're different. With nephritic, you see a lot of blood in the urine and high blood pressure. But our little guy, he has that massive swelling, but his blood pressure is normal, and there's not much blood in his urine. It's a textbook case of nephrotic syndrome. But a theory is just a theory until you have hard proof, right? So now our medical detectives head to the lab for the forensic evidence. And what they find is, well, it's the smoking gun. It cracks the case wide open. Exhibit A, the urine test. It comes back with a 4+ for protein. Now, on this kind of test, that is literally the highest it can go. It's off the charts. It's undeniable proof that those kidney filters are leaking protein like a sieve. Exhibit B, the blood test. This confirms the other side of the story. The amount of albumin, that's the main protein in our blood, is critically low. And this is so important because albumin acts like a sponge, holding water inside our blood vessels. So if all that protein is being lost in the urine, there's nothing left in the blood to hold the water. It just seeps out into the tissues, and that is what's causing all the swelling. So you see, it's the combination of these two things that's the absolute slam dunk: massive protein in the urine and super low protein in the blood. That's the smoking gun. Case closed. The diagnosis is confirmed: idiopathic nephrotic syndrome. But wait, just when you think the mystery is solved, the story takes a turn. The doctors dig a little deeper into the patient's history, and they uncover a twist. This isn't the first time this has happened. It turns out the little boy had a really similar episode just 6 months ago. He was put on steroids, which is the standard treatment, and it worked. The swelling went away. So his parents, thinking he was all better, stopped giving him the medication, and you can understand why, right? But what they didn't know is that you have to complete the full course to really knock this thing out. So this new episode, it's a relapse from an improperly treated case. And this is just so important. The way that very first episode is treated basically sets the stage for the rest of the child's life with this illness. If you cut that first treatment short, you dramatically increase the chances of it coming back again and again, which can make the whole long-term journey way more difficult. This idea of a relapse
forces us to look at the bigger picture. We're not just solving a one-time mystery anymore. We're navigating a long-term journey. And understanding these patterns of relapse is everything when it comes to managing a chronic illness like this.
So doctors actually classify patients based on how often they relapse. You've got infrequent relapses, frequent relapses. Then there are tougher cases. Steroid dependent means the illness comes back the second you lower the meds, and steroid resistant means it doesn't respond at all. And look, this isn't just about putting labels on things. This classification determines the entire game plan for treatment. Whether it's just careful monitoring or moving on to some much more powerful drugs.
Which brings us right back to our 3-year-old. Because his first treatment was incomplete, the doctors are essentially hitting the reset button. They're going to treat this relapse with the full-strength original protocol, 6 weeks of daily steroids, then another 6 weeks of steroids every other day. They're doing it by the book this time to give him the absolute best shot at a long-lasting remission.
So when you think about it, this whole case shows how looking at a chronic illness through the lens of a detective story completely changes your perspective, right? It's not just a list of miserable symptoms. It becomes a puzzle that can be solved. It's a journey where every clue, every lab result, and every decision about treatment helps to map out a clear path forward for the patient.